My name's Evan Dunham. I'm a UFC competitor. I've been fighting in the UFC for just under a decade. I started having problems with my shoulders actually before I even got in the UFC. I always had problems associated with wrestling with my shoulders. I was able to work through it, but over time it just got worse and worse and worse, to the point where I had not a lot of flexibility, not a lot of mobility in my shoulders at all. I made it about 5 or 6 years in the UFC, fighting and training all the time, before my shoulders got to the point where I really couldn't work around it. So I was looking for other solutions besides surgery. One reason I didn't want to do surgery on my shoulders is because it's a very invasive process and the shoulders can be pretty problematic. So I was afraid if I did get surgery that it would sideline me for too long. So I came across Dr. Otten and he suggested using PRP on my shoulders. My biggest concern was that it would interfere with USADA, which is the world anti-doping. But with PRP, everything comes from your own natural body. I've found a lot of success with this. I would get injections about once or twice per camp, and camp runs around 4 months long. I would find about 6 months of relief, complete relief, before they started bothering me again. Now, if I wouldn't have been training 2 to 3 times a day, every day, I think that 6 months would have been closer to a year before I had problems.
I've had the pleasure of knowing Mr. Dunham for about 5 or 6 years now, and one of my main goals with him is to reduce his pain and allow him to participate in mixed martial arts. When I initially met Evan a few years ago, we took x-rays and we had MRIs at our disposal. He had developed significant post-traumatic arthritis, which is very common in patients. Initially, I discussed possible surgical interventions with him or even stem cell therapies, but he wanted only 4 to 5 days of downtime after each procedure. Specifically with Evan, he produces something called interleukin-1 receptor antagonist. Basically, it's your body's own cortisone, only naturally, and it doesn't degrade the joints. So for him, what we did was we would inject him 4 to 6 weeks prior to his events or his competitions. What we found with Evan was that platelet-rich plasma therapy was exquisitely effective in him to reduce his pain and keep him in the ring.
Dr. Otten's a great guy. From the day that I met him, we clicked right away. Great personality, really easy to get along with, and doesn't talk down to you like many other doctors. Tries to explain things to you so that you fully understand your options. And so when you decide to make a choice, whether it's surgery or PRP or stem cells or whatever it may be, you have an educated decision. I've got nothing but positive reviews when it comes to PRP and Dr. Otten, and really he extended my career about 4 or 5 years. I just retired and I plan on using PRP from this point forward to keep my shoulders in good health.